Yes.
So we have one more.
Yep. So we have you two first with the microphones. I mean. No. Yes. Yeah, less. No, 2 minutes. 2 minutes video, 5 minutes talking, max, something like that. Yeah.
Okay, so welcome back. Thanks for being with us here at the World Expo Dubai and of course online for this last but not least workshop of today, and this I would say quite interesting and of course intense event with a number of activities that we have mentioned already earlier today. So I'm very pleased to be here with a number of friends and colleagues from different countries in Europe and in the world, and we will discuss about artificial intelligence and health, in particular artificial intelligence for health and healthcare. And I have the pleasure to be here with a number of experts that I will introduce one at a time. At the moment, we will go through their presentation and the discussion that we have framed, similar to the one that was moderated by Gri before. We will have a presentation of three projects, three EU-funded projects on AI for health, and we have here, in fact, Karim and Kadir, Federico Alvarez Garcia, and also we have another expert that unfortunately couldn't make it in person, Stefano Stramigioli, but we will have also the video of this project. And then we will go through with the panel and discussing specific issues. And of course, I'm here with the support of Signe Dagobert, that has been actually very instrumental in preparing the background paper for setting the stage of the discussion. And actually, both these workshops are not just two workshops, but actually we have been framing them within the context of this European AI Excellence and Trust in the World event and series of activities as a starting point of what we call deep dives that are in practice more in-depth analysis of the challenges and the opportunities for international cooperation in this field. So these workshops and the discussion on this workshop will be actually summarized in a report where we will have the inputs and the experts, but also will be, as I say, the starting point for further discussion somewhere else in Europe and in the world. So with no further ado, I would actually unless Signe wants to say something now.
No, I think you put it very, very nicely. So I think let's continue with the first project, Gianluca.
Thanks. Maybe you want to introduce it?
Yes. Well, the first project we have is with Karim Degamia, who is joining us with the project EU Cam Image. Karim, let's start with watching the video, and then you can talk a little bit about your project afterwards.
Currently, nearly all cancer treatments are guided based on human expertise and medical images. These images are typically stored locally in each hospital. Central image collections of past exams with open access generally don't exist yet in Europe. Imagine what we could achieve by combining large image collections with artificial intelligence. This would create unprecedented opportunities for cancer research and treatment optimization. The goal of the You-Can-Image project is to build a highly secure, large-scale and federated European cancer imaging platform with capabilities that will greatly enhance the potential of artificial intelligence in oncology. The You-Can-Image platform will include 25,000 new data points for research to improve the detection of small liver tumours and metastases of colorectal cancer, and for estimating subtypes of breast tumours for planning the correct treatment. The platform we're building will be cross-linked to existing biological and health databases. This allows the development of AI solutions that integrate different types of data, including genetic, molecular, and biochemical, into dense, patient-specific cancer fingerprints. To deliver this platform, we will connect to other research infrastructures, cloud computing capabilities, and build upon several key European initiatives in high-quality data sharing for personalized medicine research, including Eurobioimaging and the European Genome-Phenome Archive. Furthermore, we're working together with the Cancer Imaging Archive, a well-established cancer imaging repository in the US. This allows us to leverage their unique years-long experience in cancer imaging storage, curation, and management. Our close collaboration between world-renowned experts in cancer research, AI, and bioethics will establish necessary guidelines for developing standardized, trusted, and transferable decision support systems in future clinical oncology. Follow You-Can-Image to find out how imaging data and data sharing can contribute to the fight against cancer through artificial intelligence.
Well, quite fascinating, and so merci Karim pour être ici avec nous. So Karim Lekadir is actually the director of the Artificial Intelligence in Medicine Lab at the Universidad de Barcelona in Spain. So it's not by accident that we are here also in the Spanish pavilion. This is one of the excellence that we have in Europe. And he has a PhD from Imperial College London, and also was previously a researcher at Stanford University. So he has specific focus on data science and machine learning, and is coordinating and has been coordinating several projects, including You-Can-Image, but also other like You-Can-Share, and we discovered quite some common interest in also going beyond Europe, in Africa and other countries. So he will tell us a bit more of this project in particular that has been funded by the EU, and other activities that is also recently been awarded. Congratulations.
Yes, thank you for the introduction, and thank you for the invitation. It's an honor to be here. What can I say about You-Can-Image? First of all, I think the core idea is that to tackle these problems, these clinical problems around cancer, to improve, for example, early diagnosis, to improve the selection of treatment for patients, we need AI, but we need trustworthy AI, and therefore we're going to tackle it through a highly collaborative, multinational, multi-center, multi-stakeholder approach. So at the level of data, we're going to do this by building a federated data network. So why do we need a federated data network? Why not use just data from a single hospital, for example, in Barcelona? Because at the end of the day, building a federated data network is more complicated. It means talking to multiple hospitals in multiple countries with different legal constraints, different data format, and so on. But the advantages are massive. The first is that the data will be highly rich, highly heterogeneous. It will take into account diversity between populations, between clinical practices, data characteristics, and so on. So the AI solution should be more generalizable, hopefully more trustworthy than building them from one single center. And then working with multiple countries, multiple centers, and this is also something that we have that is unique in Europe, is particularly the project funded by the European Commission. They're always multi-country, minimum 3 countries, on average 5, 6 countries. We've seen today, in our case, it's 11 countries, is that we can count on expertise from different perspectives, different cultures, different domains, from engineering, medicine, social sciences, ethics, etc. And then geographically, we wanted to expand on that, so we have expertise within Europe, from all regions, Northern, Western, Southern, and also Eastern Europe. For example, we have partners from Poland and Lithuania, but also we have a partner from the United States. They have built the cancer imaging archive years ago, and they have strong experience, and we're working with them. And following on this idea, we wanted to expand because, as I said, we really believe in this collaborative approach. And with the help of DigiConnect, which is one of the agencies of the European Commission that is managing actually this particular program, AI for Cancer Imaging, we connected to the other projects that work in the same field that are developing also similar approaches. And we built a bigger network, actually that is managed by Isabel, AI for Health Imaging Network, where we are now 90 institutions from 25 countries across Europe. We're working together to have really a very highly collaborative approach at scale. So one thing we did, for example, is we put together guidelines, starting from the work that was mentioned several times, of the high-level expert group on AI of the European Commission, and we adapted to the problem of first on oncology, cancer imaging, and then we expanded to medicine. So we came up with guidelines, which we call Future AI. So each letter in the acronym is a principle that we follow. So fairness, universality, traceability, usability, robustness, and explainability. And we have concrete recommendations that we put together, again, through consensus and discussion between all these partners to come up with something that is scalable. Finally, to say that we also started working on follow-up initiatives. So we wrote a grant proposal for the Horizon Europe program in September to perform a large-scale clinical validation of an AI solution. So the project is called RadioVal because the solution itself is radiomics validation. And in that project, not only would they can have European countries, so Croatia, Austria, Spain, Sweden, and Poland, but we decided to include international hospitals in South America, in Africa, and in Asia. The project will start in October, but again with this idea of a large-scale international, highly collaborative approach for trustworthy AI in cancer imaging. Thank you.
Merci, Karim. Very interesting, and I'm sure we will go back into these more in detail during the discussion. Now, we move from Barcelona to Madrid, so we remain in Spain, and as I say, this was, because there's been selection of really excellent projects that have been funded and that developed networks and results that are visible. And in this case, again, they are really visible because we're talking about, again, media and image. And we have the GenoMed for All project that is based on AI-guided omics-driven research for hematological diseases. But let's see the video first, and then we ask Federico to explain better. Okay, so Federico Alvarez is a professor in the Universidad Politécnica de Madrid, and actually he has a long experience, a long track record in EU research, especially in the areas of AI applied to media and health sectors. So this is really an important focus of trying to, let's say, bridge the technical aspect with the, the human-centric aspect that, as we have seen in this project, is fundamental, because we are really addressing, challenges of our time and that have an impact at the global level. So, Federico, can you tell us a bit more about these and project and similar activities you are involved in?
Okay, so thank you very much, Luca. And that's good. I'm the second one because our project has a lot of similarities with what Karim presented. In one sense, it's the concept of federation, and we go a bit beyond. We do the federated learning in the sense of, if you want genomic information, this is really private from a patient. So any of you would like to share your genomic information openly? Maybe no. But if we do in a way that this information stays in the hospital where the patient gave the consent, then we can create a big network. And this big network, in the case of hematological diseases, is really important because they are rare. So there's not so many cases in Europe. So we want to connect all the repositories. And so the physicians can do the research, AI researchers can do their research, and as well, the patient associations may get some real and concrete results of what we are doing. Well, I'm an engineer, okay? I engineer things. Sometimes, with results, sometimes not. But what I learned here in Genomed is that there are different constituencies and different ways of seeing deployment. So we had a meeting with some patient associations, and they said, okay, good guys, fantastic work, so when are you going to change the way my disease is going to be treated? So there's something that we would like to change. So in this project, we are adding, we're using some omics information. That means that we use images, right? We use clinical information, but also genomic information, because the majority of hematological diseases, they have a genetic background. And we'd like to change the way and find new patterns. And the only way is really to combine 3 points. First, a platform, because you need to compute data. At the end, you need compute models, and to compete, you need good infrastructure, so we have a supercomputing center. Then, of course, we need clinical sites. We have 10. But we want to scale up. So the way of scaling up is to keep the privacy, so the data is not moved from the hospitals. And in that way, we can connect more and more and more sites in the future. And we are doing with distributed algorithms, okay? And we think that is a very reasonable way, because we are building on top, because the European Commission is really nice, because they not only funded our project, but they funded EuroBloodNet, that is a European research network. And there are more than 100 members currently, clinical members, and they would like to get our algorithms and test them there. So we want to reach all of the members, so we really create a big footprint of our project. That's another point that we think that is relevant, is that about the standardization of data for genomic information. Okay, there are some, let's say, some standards, but maybe there are too many. So we want as well to find a way that people can cooperate with the same standard to doing that research. And the third part, that is the AI part, is, let's say, how to apply new models to that kind of diseases. When we would like to merge genomic, images, clinical, that there are some examples, but not so much. So thanks, and because the European Commission is funding this kind of projects, we can start doing this in that field. If not, I believe it's difficult that for the private research to invest in this. So we believe that as soon as we have results, of course, the private industry will go on. We have 3 use cases, as I said. Okay, I'm not going to enter so much details. Some are oncological, some of them are non-oncological, and we'd like to really go in deep detail and find and saying the new ways of prognosis, of optimal treatment, and of finding better survival analysis and some of the classical things, but to find, as I say, new patterns thanks to the AI that we are working on. And last but not least, this is the part that we are working, that is the, let's say, ethical and data protection. Because I think it's interesting in the way we are doing and the way Karim is doing, that if we would like to cooperate outside Europe, we know how we did with 11 countries, with 12 countries, with 25 countries, and we can export that to the rest of the world. They can cooperate on that federated structure. So I think that it's not an issue. So engineers were trying to find a way of let's say, coping with a model that we can exchange cross-border data in a way that we keep the user privacy, its protection, and the European values. And this is something that I would like to scale up in the future. So yes, if you have, people that like to, or hospitals that would like to cooperate with us, we are really open. And we are offering our, of course, algorithms and way of doing the federated learning and some other aspects. And I would like to open this to new areas. So at the benefit of the European citizens that unfortunately are suffering this kind of diseases. So that's more or less in a nutshell what we are doing and we plan to do.
Bueno, muchas gracias, Federico. And this is really, just, two of the many examples that actually the European research is supporting, or activities that are very important exactly to address the challenges we are faced with. But then, as many of you know, and it was mentioned also yesterday, we move from what is in Europe we are supporting the ecosystem of excellence of artificial intelligence. That is this. Our research is really developing a possible solution using technology, but then to the ecosystem of trust. And so how we move from the industry, from the research to industry. So in this sense, the other project that has been selected to showcase is DIagnostics.eu, that is building on the infrastructure that of digital innovation hubs, in this case specific for healthcare robotics, with the idea to establish a pan-European network of digital innovation hubs specialized in this field. And actually, as it was in one of the video, it really looks at connecting prevention, diagnosis, treatment, and care. And so we will see now the video of this very important project.
Maybe we should mention that it's led by Stefano Stamioli before we start the video. So, and he would have loved to be here today, but unfortunately he had to send his apologies. But here's the video.
The DIagnostics.eu is a pan-European network of public and private stakeholders, SMEs and large companies who operate in the innovation chain, bringing robotics to the healthcare domain. The network brings the fourth industrial revolution to healthcare. Digital technologies are opening up new horizons with robotics, artificial intelligence, and big data-driven innovations. To unlock this potential, digital innovation hubs ensure that every business in Europe, wherever the location, whatever the size, can draw full benefits from digital innovation. The initiating 17 partners in this network have a profound track record for stimulating robotics innovation in the healthcare domain, from diagnostic to therapeutic and assistive to rehabilitation robotics. They together form the digital innovation hubs of healthcare in robotics, the DIagnostics.eu. Each core partner is surrounded by associate partners who complement the services and knowledge domains to strengthen the network. Together, they form a network of digital innovation hubs spread across the regions. Each regional hub will help companies, especially SMEs and startups, by connecting them across the network to healthcare providers and digital services that can accelerate their business development. To do this, digital hubs offer the following services: access to robotics and digital technology expertise, infrastructure to test healthcare innovations, finance and business advice, market intelligence and networking opportunities. The DIH Hero Network stimulates collaboration across Europe, engaging healthcare providers and policymakers, raising awareness of robotics, smoothing the path of innovation, and connecting the market across Europe. Are you ready to join the revolution? Join the DIH Hero Network and find out.
Yes, and as Signe say, unfortunately, Professor Stefano Stramigioli could not be with us today, but I mean, really is a leading scientist in this field and is actually Vice President for members' activities of the IEEE Robotics and Automation Society, and of course, a coordinator of this large network, Generation Hubs, but also, of course, a researcher from the University of Twente, where he's based with a long track of scientific achievement. But I'm sure we will meet with Stefan also in the next steps of these let's say, activities and of research, try to better understand exactly how we can leverage the European networks and excellence in research and also engage with the international community. Because we have seen, and the pandemic showed and is showing us how, we have all over the world similar challenges. Of course, we have, for instance, shortage of healthcare professionals, aging population in some countries, or other challenges, financial limitations, and so pressures that are, let's say, challenging the very fundamental foundation of the healthcare systems, and technologies, and artificial intelligence in particular, can be really a great opportunity to simplify the life of the patients, the doctors, and of course the hospital administration. So clearly there are a lot of opportunities in this area, but of course, as we say, there's some risks, some possible challenges that we need to address. And in Europe, in fact, there are a number of activities, not only from the regulatory perspective, but also from data governance and from the technological perspective that has been addressed. But let's now move, in fact, to the debate. And so I would actually start, in fact, with Malavika Yayaram. This is becoming, something we do always. Like yesterday, to start with Malavika, because we are really excited to have you here, and it's really a pleasure. As yesterday, we followed the high-level panel on the EU vision for trustworthy AI. Malavika was among the distinguished panelists, and she comes actually now from India, but she has really a global knowledge and experience, in particular from the Asia and the Digital Asia Hub you are leading, but also your academic affiliation with the Berkman Center in Harvard, and all the wonderful work you have done. So basically, to engage just here among us in the discussion, we have seen, and someone mentioned that data are, of course, the first element to consider on all this. So how we make sure that the data protection, or the protection of personal data, can coexist with allowing personal data to flow for free, let's say, to free flow, let's say. What's your view on that?
Thank you for having me, and for being brave enough to have me go first again. Because I'm that difficult person who sees things like, are you ready to join the revolution? And I'm going, no, I'm not. So it's very brave for you to give me the floor first. You're asking me about, data versus, all the good and benefits that can come about it. And I think, for me, framing these things as binaries is really problematic, because I think I mean, I've always said that the road to privacy hell is paved with balancing intentions and balancing metaphors. And I think seeing it as an either-or is very, very problematic. And I think that that's what often happens, you know, as if you're pitting innovation against security and privacy, or, you know, pitting development against regressive, you know, going backwards kind of policies. So I think the first thing I would say is that it isn't a binary. You can actually optimize for both. You can have privacy and trust. You can have adoption and security. So I think that's the very first point I'd like to make. And I think actually having strong data protection laws and regulations, it's actually essential to building trust. More than any other kind of data. I mean, you know, meteorological data may not be very sensitive. Agricultural data, which we talked about, may not reveal personal preferences and, you know, very deeply individual attributes. But something like health is so sensitive for so many, you know, reasons that I don't need to explain, that I think this is an area where if you don't get trust right, and if you don't calibrate, you know, that relationship between people's autonomy and agency and the benefits that these new technologies can have, the harms are so huge and the stakes are so big that I think not recognizing that privacy and data protection norms are actually integral to allowing people to share freely, to allowing data to flow. I think that's a really important point to keep in mind. Often when people frame these sort of questions, it seems to me that the people on the side of innovation almost proceed from a position of entitlement, where they feel entitled to use people's data, and they're annoyed that there are roadblocks. They're annoyed that there's regulation, that there are things preventing them from using it, as if it's something that is naturally accruing to them, that they have, you know, some divine right to use and remix and use, often under narratives of like for the public good, in the public interest. So I'm really allergic to all of these sort of AI for good kind of narratives. I know they are really doing good in a lot of cases, but the fact that you even need to have a subset saying AI for good makes me really wonder, like, who are the people working on the AI for bad? Can we go to their conferences? Because they're probably much more fun. So the fact that you even need to sort of have this caveat about good, I think tells you a lot about the amount of effort that it takes to actually have good be privileged, when there are so many ways that bad can actually happen very, very easily. When you don't provide the right frameworks, you don't provide the right mechanisms to build trust. And if people don't trust that very sensitive health information is going to be deleted, that is only going to be used for the purposes for which it's gathered, if you don't have all the principles we've had through data protection law, purpose limitation, data minimization, right to deletion, right to erasure, right to explainability, if you don't have all of those guardrails, I think this is going to be a runaway train that only benefits people who want to make money off of these and don't necessarily benefit the intended recipients, especially when they're scattered over the world and where they're not really included in a lot of these programs, where their data doesn't form part of databases, where you have overwhelmingly, you know, white and male data sets. And if you don't have different categories, different demographics represented, I think that's a really lost opportunity, not just because of human rights and wanting people to be included, but even from a very statistical and mathematical sense of accuracy and specificity, I think it's really important to actually allow trust in data through data protection norms to allow data to be used responsibly.
Thanks a lot, Malavika, and I'm sure that Fosca will have a question, will have answer to this, but maybe while they sanitize their mic, maybe we can ask first Ronnie, because you know, you have and Ronnie Medaglia is a professor for digitalization in the public sector, is professor with special responsibility at Copenhagen Business School, and he's actually focusing in his research exactly on the transformative impacts of digital technology, including artificial intelligence in government and, of course, in the public-private partnership that were mentioned earlier today as an important aspect to consider in the building of the ecosystems we have been mentioning before. And of course, he has also an international perspective, so some of the research he has been doing goes beyond Europe. So maybe Ronnie can tell us a bit what are, based on the evidence of your research, the biggest challenges in the adoption of AI, let's say in the public sector in general, but specifically on healthcare, and how these are actually perceived by the key stakeholders, because this is also very important. Sometimes we may think we know something, but then maybe the research can tell us that we were wrong. So.
Yes. Thank you very much, and I'm very honored to be here and share the stage with people that I can learn a lot from and share some of the experiences. So, what you ask about the evidence of empirical research really points to a lot of overlap on the things that we have discussed about. So we talk about, the issues of trust, the issues of explainability, and the issues of data integration and sharing, obviously, are key there. I think one of the things that I would like to stress is the fact that at some level, and this is shared both within research on health sector, but also public sector in general, is the decade-long challenge of resistance to data sharing. So we need economies of scale to feed the algorithms. We need quality integrated data. And sometimes this is, as AI in general, challenges are not just technical challenges, but they are social technical challenges. And this includes power and politics. So one of the studies we've been doing some time ago was about hospitals having to share data to train algorithms for cancer diagnosis. And one of the things that interviewed doctors and hospital managers and also government officials, here we're talking about a context of public health care, were mentioning was organizational resistance by the hospital who feel ownership towards the data. So the moment we enter into these organizational dynamics, we see a lot of the good old power and politics at play. And I think this is something to take into account when we are thinking about how Europe and European institutions can help overcome and provide incentives for data sharing, for quality data production. So I was very glad to hear about the work that Federico and Karim are doing, because I think they are really nailing down one of the key issues that are related to this. The other thing I want to stress more in general is that, of course, there's a great agreement both on stage and off stage in the coffee breaks about this issue of creating excellence, an ecosystem of trust and the importance of trust, and of course we all agree on that. But ever since the formulation of this duality of AI excellence, creation of ecosystem of excellence, and creation of ecosystem of trust in the white paper by the Commission a couple of years ago, I feel that we need also to understand that there's synergy between them, where I would say maybe provocatively that the building of an ecosystem of trust is instrumental eventually to creating an ecosystem of excellence. Because maybe I'm going to be provocative here, or I'm pointing out the elephant in the room, but as we speak, we are standing on the rubbles of a huge defeat that Europe had in the previous wave of technology, which was the Web 2.0. When we read about, for instance, social media and data management in social media, the role of Europe is always the one that comes and gives fines to the ones who break the trust and so forth, which is great. We're very good at doing that. But the players are always North American, maybe in Asia, and somewhere else. The social media train has passed, and Europe hasn't played a protagonist role there. So now there's this huge window of opportunity, Web 3.0, Industry 4.0. I think we are at a critical moment where Europe can really leverage its value-based ecosystem and energies in society to leverage this opportunity. I heard this very nice metaphor, and then I feel I'm allowed to say here in the Spanish pavilion, it's a football metaphor. If you want to win the Champions League, you cannot just be a referee. You need to be a player in the field. So I would just like to stress how empirical evidence from research, but also my own understanding of the European traits of digitalization in the public sector show how we need to leverage the strength to eventually create this excellence. And this comes through creating quality data, economies of scale, involving stakeholders. Multi-stakeholders approach has been mentioned before by Karim, and I want to stress that the importance of including all stakeholders, so not only patients, doctors, hospital managers, IT providers, in designing and co-creating value through AI. I think this is a train we cannot miss, and there are unique qualities to the European approach. I'm Italian myself. I moved to a place like Denmark, which is famous, for instance, for its own Scandinavian approach to information systems development. That's also another unique element of user co-creation, citizen involvement that we need to bring in.
Well, thanks a lot, Ronnie. And now if we go back to Fosca, and Fosca was also yesterday, for who attended the high-level panel, one of the panelists. So Fosca is a professor at the Scuola Normale Superiore di Pisa, and also director of the Knowledge Discovery and Data Mining Laboratory, and has been a pioneer in this field, and has also been coordinating the So Big Data initiative, but also has a new very important project that is a European Research Council advanced grant called SAI, Science and Technology for the Explanation of AI Decision Making. So, and this is exactly in this sense that, given the challenges and the barriers that have been mentioned for the adoption of this technology in the public services. So what is, in your opinion, that could be done to actually provide more transparency regarding the algorithms and system development in this specific area of healthcare?
Thanks for organizing this. Thanks for the questions. Actually, decision making in very high-stakes scenario, it's very complex socio-technical systems. So humans, the decisions there that are taking decisions, that have the responsibility of a decision on human lives. I think it's very complex to also when we want to insert AI-assisted technology in this process. We have to understand better this process. So this process is it's how they take the decision. I have in mind this model of Dr. House. Well, when Dr. House is taking a decision, he's not alone. He has a lot of different sources of information. He collaborates with a lot of different agents, which are bringing to him informations, new hypotheses, challenges, and they do mistakes. So when we are going we want to insert there an AI assistant, we have to know that we are in a very complex socio-technical systems where the humans are, they are also, when they are taking this decision, influenced by experts, by others, they have bias as well. So it's not that, so first of all, this is I think one of the most complex systems. So very often it is as a barrier of using AI, and I mean the bad news is that AI is not used very much in that system. So all those nice projects that you have mentioned here are fundamental for really uptaking more AI technology in health, because it's not used very much. There are some recent numbers that say that only the 15% of European health institutions are really using AI. So that's and barriers, as you were saying, sometimes it's trust, and so explainability may play a role there, trying to understand. So and there are good news on this side. So explainability technology, now it is can provide good forms of explanation. It can provide, I'd say, on images, for example, as we were saying before. So some of examples can really show which are the portion of the images which are responsible for a particular diagnosis, or they can produce counterexamples, activating an important cognition process as a counterfactual reasoning, so that you can start to think, okay, this is the reason why this has been predicted in this outcome, but what you can change for having a different outcome. So the technology is working on this. The technology is also trying to provide a sort of causal reasoning. So it has been predicted like this. So the spot on the image of the spot has been predicted to be high risk for cancer because of this portion of the images which was highly risk. And you can change what might be different, what are different. So you can have a sort of what we call counter-examples. You can be exposed to images which are very, very close, but are a different outcome. So can be highlighted what is the reason of that specific outcome. However, we are not yet in a good, so that's the good part. But if you think to Dr. House, it's interacting with many people. So that means that the kind of explanation which are still working on, it's the one that really activate with a doctor a conversation. So a conversation, and a conversation such that all those different forms of explanation, which are almost there in terms of technology, can be used in order to activate the appropriate cognitive process. In order to do that, we have to know which are the appropriate cognitive process. So that means it's not enough what the computer scientists, the machine learning people know, but we need also to engage, in order to have a very good engagement of such users, so activate the appropriate cognitive process, we need to collaborate with people that know very well. So like psychologists that are experts of decision making in terms of psychological paths that are there. So it's changed a bit the goal. It's not anymore so only providing explanation of the black box is not enough. You have to engage a conversation with the user. That will be really the change. And this is also implies a lot of difference in the change of the algorithms. They have the machine learning algorithms have to change because they have to be capable in order to engage in, to say when they are very good to do the prediction, and also so they have to say, I know that I don't know. So in some sense they have to stop to defer the decisions, because on this part maybe there is the need of the humans asking for extra information. Exactly in this model of the Dr. House, which are interact and continue to, but engaging the users, it's very complex. So that's
well, thanks a lot. And actually, this brings us to Isabel, because in fact one of the questions is how can AI actually contribute to an enhanced engagement and empowerment of the patients. And Isabel is here also. She's involved in Human-Image, as Karim said, as a project network coordinator, but also she's a researcher from the University of Barcelona, and specifically on the let's say on research activities, on research projects, and has a large experience on also making sure that you know that there is this transfer from lab to market, if you want. So how you from the research you can then go into the industry. And so what are the strategy that you would suggest to be implemented to actually increase involvement of AI patients?
Yes, thank you very much for the introduction, and I'm honored to be here. And it's true, it's a great connection to also my answer. Yes, it's very important that patients are engaged, that they feel involved in the decision-making process, and it is very important that they feel involved from a very early stage on. So even when you start your question, like what should I develop, it should already have like the patient's needs, preferences, and opinions already included. So to empower patients, to make them feel included, AI can support them by helping them voice their opinion, to have the healthcare professional understand the needs, the preferences of the patient, and not base their decisions on assumption based on their age, weight, height, nationality, or the other classifications. So I think it is very important to just make sure that the AI has different aspects to make it more understandable for the patients. So for example, we can start by making the AI helps to make the health topic more accessible. So AI uses non-scientific, non-scientific language, so it's more understandable. It understands the level of health knowledge, for example, of the patient. They better understand like their own situation. They can base their own opinion based on like what the AI is like, taking in consideration their own health, like their own biomarkers, their genomic data and everything, taking that into consideration and helping the patient to actually understand what would be best for them or what could be best for them. I mean, in the end, AI is not perfect, so obviously there should be a discussion with the healthcare professional, and based on taking all the information in consideration, they can have a more educated opinion on what is best for them. And then second, I think data should be also, AI should make it also more available, especially for low and middle income countries. For example, they don't have like the same access to digital tools, so AI can help making tools more accessible to low-cost devices, for example, and it is also more easily findable. Like, you know, you instead of just having a paper or having like this platform where you have to register or anything, you can have like a simple way to access your information, to be aware like where is my data stored, how is it used and everything. And then last thing, which is also one of the main topics during today's discussion, is explainability. It should help the patients understand how is the AI working, what is it taking in consideration, how accurate is the suggestions, the outcomes, and yeah. So overall, it can help the patient to better understand their entire situation. And yeah, going back to the same thing, engage the patient early to make to see that it's actually the entire outcome is optimized for their own personal health. It's addressing their opinions, their needs and requirements, and show that they can actually be involved in the decision-making process.
Thanks a lot, and well, Signe, it's not bad, huh? A very interesting discussion. I'm learning a lot, and I hope everybody here. And actually, let me turn to you, Signe, because so for everybody to know, I mean, Signe was not only really the one behind the scene preparing all these discussion and the background paper, but she's, I mean, I would say she's really the expert in when it comes to assessing the impact of artificial intelligence for health. She's currently the head of the AI unit and the senior researcher at the Advanced School of Health Economics and Management of the Università Cattolica del Sacro Cuore in Rome. That is my city, so very glad. But of course, she's from Copenhagen, where she got her PhD degree exactly in health and medical sciences. And she has really a background on this specific topic of clinical epidemiology and social inequality in health. So she's also involved in another interesting project that is AI Mind, that also try to link the use of technologies like AI with for healthcare with social care and what is happening outside, let's say, of the healthcare system. And actually, in the previous workshop, I liked very much when Spiros say that for an AI researcher, you want to use AI for everything, but then it was discussed also for the topic of sustainability, that sometimes you may ask yourself why you're using this AI, and same for health. So maybe we should also, and we've been discussing about decision-making processes quite a lot, and the involvement of different stakeholders. So, Signe, what is the type of support that is needed exactly in this decision-making process? I mean, to decide whether or not to use a specific AI-supported health technologies.
Well, thank you very much for this question, and also for inviting me on the stage together with these fantastic experts today and the two other projects. Well, I just want to start by specifying that health technology is a very broad concept of what you say. It covers knowledge and skills that are collected, and it can be any source of technology. From a new medication, it could be a new vaccine, for example, as we see now with the COVID. It can be a new care pathway, it could also be a technology, a health technology, or it could be AI-supported technology, as we are discussing here today. So what I do is I support decision makers in whether or not to implement these new technologies, again, whether it's a vaccine or a new treatment or an AI solution. So I don't do the decision myself. I just collect all the information they need on an evidence-based, multidisciplinary approach to give them as much information as possible, so they have the overview. How is this new technology affecting the clinical effectiveness? Is it cost-effective? Does it cost more money? Will we save money? What ethical aspects do we need to take into consideration? Social, organizational aspects. Will it change something in our organization, in the hospital, care pathways, and so on, when we implement these new technologies? So to do this, we actually have a very good framework, or we have many frameworks in Europe. The one we use the most famous one is called the core model, where we are assessing all these aspects and collecting this information. So hospital management, or it could be regional levels or national levels for national guidelines, they decide whether or not to implement. And a year ago, 2 years ago, we started this project, as you say, AI Mind, which is about early detection of dementia using AI technology. And me and my department at the Catholic University, we are in charge of the assessment of this new technology, So we were like, well, we have a fantastic framework for assessing. We will use a core model because it has these 9 aspects, and we will have the multidisciplinary approach, and everything will be good. We wrote it into the proposal, and luckily we won. And then, the first task was to start making this framework. So, okay, how are we going to assess this? And it didn't take long before we realized that it's actually, even though you have all these different aspects, it's not described good enough how you deal with artificial intelligence, because artificial intelligence is not a technology like any other technologies. We were like, oh, well, we have evaluated telemedicine before. It's our ICT supported technologies. It's similar, it's technologies in that way, but it's not. Suddenly, with artificial intelligence, there's so many new aspects that are approaching, like the trustworthiness, accountability. We have evolving algorithms. So when do we assess? Because we can do an assessment, but then the algorithm would develop. So then actually what we assessed was yesterday and not today and not tomorrow. So how do we take this into consideration? Yeah, and so I think you have touched upon a lot of these aspects in the panel also, and these are new. And even though we say ethics, we have covered ethics, but it's not the ethics like the biases in the algorithms. We have not talked about this before because this was not something we were considering. So suddenly we are also stuck with this. I think we need to develop a new framework, and that's actually we had to rewrite the first task of our work package to say we are not just going to apply the already existing framework. We have to develop a framework that is specifically tailored to artificial intelligence, so we can support hospital management, department doctors at hospitals to decide whether or not to implement these technologies. And for me, I mean, the dream situation would be if we could also already be part of the development, as of course you are in a European project, but you talk about ethics by design, but can we talk about health technology assessment by design, or already including all these aspects from the beginning of the development of these technologies? So can I be a little bit bold and then maybe ask a question to one of the projects here today, or maybe both of you, because we have had some conversations over these days where we have been spending in this event, and I maybe hear the same problems that you also have run into, that this thing about trust, that you could not find a way to assess it from the beginning, and you had to develop something also. So I'm really interested, Karim, you mentioned that you had to develop also a framework for assessing the trustworthiness in your project. And of course, I'm very interested to hear about this, because this is also some of the things that we are facing in AI Mind and in any other technologies that are being supported by AI now in the implementation phase.
Yes, so indeed this is a very important question. And in our case, what we decided to do is really go concretely and understand what are the criteria, what are the metrics, what are the procedures that we need to put in place and consider, in particular when validating the AI solution. So, for example, how do you validate robustness? How do you validate usability? How do you validate fairness? And even explainability. We talk about developing explainability, but how do we validate that the actual clinicians now understand the decision making? And that's what we did. We really went one by one, again in a very collaborative manner with different stakeholders from universities, from engineering, social sciences, from private companies and so on, even associations. And we did so. So, for example, for this project that I mentioned called Radioval, so I'm advertising it, although it will start in October, we have a very clear plan, and I think it's going to be the first project that really validates trustworthiness in this particular field, which is a field called radiomics, which is a subdiscipline of medical imaging, and AI medical imaging. And so the way we do it is first have, again, what I mentioned, have a network of hospitals, have hospitals with different characteristics, different electronic health system, different population. So we had the variation of hospitals within Europe, for example, Austria versus Croatia, or Sweden versus Poland. Then we had hospitals outside Europe, different ethnic groups as well, South America, Africa, for example, versus Europe. and so on. So without going into detail, we have very specific metrics that we're going to calculate for fairness, for example, and for usability as well. So we're going to give these tools to a very specific number of clinicians. We calculated the number of clinicians that is needed across the different hospitals. We will consider different types of clinicians, those that are early stage career versus those that are experienced, that have different attitude towards digitization as well, to take all this into account. So in summary, I think we just have to dig in and really put together a very concrete methodology and go through all the criteria, not only accuracy and robustness, but really take into account everything and do it this quantitatively, qualitatively, at scale, and then report these results to the community in a transparent manner, in a way that everybody understands what the study was about, what was the result, when does the AI solution work, when does it fail, because it failed, and also put together a mechanism, and I will finish with this, put together a mechanism so you continue to track the AI solution. So this is something we will develop in this project after it is deployed. So there are periodic audits, periodic evaluation that take place automatically with new data to make sure that the performance doesn't degrade, etc.
But can you make a certification out of it? I'm thinking.
That's what we
of the trustworthiness, like we heard in the earlier debate about sustainability. They were talking about, can we make a certification saying this is a trustworthy AI, or is that taking it too far?
Well, that's what we would like to propose. We would like that future regulations take into account these types of validation that are multifaceted, comprehensive, and that just report the result. They say this is what's working, this is not what's working, and have really a mechanism so everybody can see and can get information about the technology. So I don't know if you can have an AI solution that would be working in all of these aspects, but at least we need to be transparent about the results, about the benefits and the limitations, so all the stakeholders, including the clinician and the patients, are aware of the advantages and limitations.
And in fact, if we move to Federico, I mean, because your project actually uses genomic health data, so that are, I mean, we could say that are actually some of the most private or personal data we have. So how can we actually pool and share this type of data across, European borders or even worldwide, in a secure and trustworthy manner?
Yeah, that's
simple question.
No, that's a good question. I knew you were going to push that. But yes, exactly. Genomic information is not only private information from yourself, also from your relatives. So the point is the following. Yeah, you can do a lot of things, and I think it's one of the opportunities for AI, but as well has two big issues. First, it is so private, and second is that, as you say, the cross-border sharing of that kind of information, it's difficult also, not only because of legislations, it's because of, as well, you are using something that you can use for other purposes, not only for good reasons. Okay, you can stratify populations, so there's a lot of things behind that, and as you may know, that using AI on this genomic and on others, of course, has this some risks, trustworthiness. Okay, question, Karim. What do you think about 99.9% of accuracy? It's good or not? Okay, 99.99. Depends. 99.999. What that means, if we continue with nines, means that maybe one person in a million will fail completely. So we are going to make a mistake. So let's say that... Usually not. So at the end, let's say we are, helping or supporting the decision-making of physicians and people. So that's something that we should do as well with genomic information. We cannot have a diagnosis on this, or let's say an optimal treatment on this. We need to find patterns and points that should be examined to find it out. And the good thing is that having as well the cross-border exchange, we find new patterns that also depends on the kind of patients that we have. Of course, that's a lot of data that involves the genomic information. That's something that is not good. It's not to analyze. But of course, we need to find a way of doing on legal aspects, as well on the way to federate it, I believe is the only way to scale up. And the third point about trustworthiness is that it's difficult to understand for people, for patients, because it's, you know, maybe you understand some images, maybe on clinical, but on genomics, have you seen the one archive on this? So it's, you know, so there are some things that even were not discovered, let's say 10 years ago. So I think that we also need to support the exchange, the trust, the way of researchers are doing, our understanding, and this path to go forward, in my view. That's something, but you know that even people are using apps from, you know, Google Play, that are for health and without asking what they are doing. So also physicians. So let's say that also is a bit chaotic, that part on AI. Now we can ask the audience. So have you ever used one of these apps for health? Anyone? No? Yes? 1, 2, 3, 4. Have you checked the algorithm, trustworthiness, and what's the privacy and others? Or did you accept all conditions? Yes. So let's say that as well, we need to reinforce that. And I think that the research should reinforce that on that aspect, and I shut up.
Thanks, Federico. Actually, and you rightly pointed to the audience, because we have an audience here in Dubai at the World Expo. So I would actually take the risk to ask if someone wants to jump into the conversation and ask a question to our panelists, and maybe we can ask to prepare a microphone. I see a couple of questions already, and so if we have someone else that wants to join. So I see Paul. Paul? Yeah. Do we have a microphone we can... Sorry, we are living in challenging times, including COVID. So, and maybe you can introduce yourself also.
Yeah, sure. Oh, it is working. Yeah, Paul Waller from Thorney Isle Research. We independent research into technology and governance. Following directly on from the conversation about Senior raised and assessment. Go back 5 years, there were lots of diagnostic systems hyped in the States that were going to replace consultants by about now. And recently we've seen more papers in The Lancet, for example, where researchers have just demonstrated that those things just do not work when they're taken out of the development environment into real life. It's playing on the point you were just making. But can you say a bit more about what you're doing? But I'm interested in the context of how you would take the methods for determining that something is going to work in real life and generalize that to something that a medical regulator, a medical product and tools regulator can use, because in every other walk of life of medical devices and treatments, it has to go through a regulatory approval process. This should be the same. So what can we take from those projects and put into that regulatory space? Thank you.
I don't know, Paul was looking at you, so maybe you should answer.
I think he was asking the...
Yes, so what regulatory agencies, for example, could take from this project is to extend the current approaches, particularly for evaluation, to make them more comprehensive, more multifaceted. For example, it is not requested at the moment to check whether the AI solution works equally well for men and women, or for a population of different ethnic groups. We could change this into some type of requirement, the list of the evaluation steps that need to be performed as part of the regulatory process. Something for the future. And I hope that the project we're performing will show that this is actually useful, that it's useful to do this. Because when you don't do this, you get bad surprises sometimes, unexpected surprises about those sorts of biases. This is just an example. Huh? That's one thing. And then I think that it's important to then talk to the clinical communities to see how the introduction of AI will change the clinical guidelines. So that's very, very important, because doctors work with very specific clinical guidelines that spend years to put together through consensus, and suddenly you put an actor in the middle, which is the AI. And I think you can build any trustworthy solution, but if it doesn't take into account this clinical integration, they're not going to use it because it upsets the way they usually work. So we need to work with the professional societies so they can take the result of this project and then see how they can update their clinical guidelines. Obviously, we need to work on cost effectiveness, for example, so that the medical technologies, we can show that they're cost effective in the real world. So that's how you go from something that is research, has been even actually proven for trustworthiness, into something that actually will be used. So there are these extra steps. In particular, the regulation, I think, should be enhanced.
Yeah, I second that. At the end, and you know, AI, it's something that, according to regulation, will be treated the same way as a medical device. So you will need to follow all the steps of the study. Okay, you have some, you know, imaging machines that now are implementing the AI inside, so they need to be, okay, similar to others, and we need to demonstrate that really, if moving from one environment to other is working. I have seen a lot of algorithms that are working with very well with some data. When they move with the data with, you know, with noise, or that is not so good, not so perfect images, are not working with better than, let's say, any former systems. So as well, you need to demonstrate that it's a working environment, it's secure, that to be used, and yeah, of course, regulation is needed to avoid that anyone is using something that you know, may lead to mistakes. We are talking about healthcare.
So we have another question from. Well, I don't think she needs to be introduced again. From Amy. So.
So I have two questions, actually, if I'm allowed. The first one is specifically for Federico, and then the second one is for all of the leads of the projects. My first question is, you mentioned disclosure of new kinds of information. So when we're talking about genetic data, you can predict early onset of different diseases, or you know, hereditary diseases, you know, and all of the people that could be affected. Have you come across this in the project so far with either industry or research partners? And do you have a process in place for dealing with this? You know, you say that you're working with anonymized data, but right, you could find, yeah, we know that we can de-anonymize data. So that's my first question. And then my second question has to do with both of the projects. So linking this panel with the other panel, which was focused on issues of sustainability. And we're talking about the benefits to individuals in the healthcare space, the quote-unquote patient. Yeah? And then if we start to talk about human-centric AI, the human that is, you know, at the center of all of this. So we're talking about the benefit of certain patients. Of course, this is the EU context. These are EU projects. I understand that. So I'm just trying to be provocative here. But in the first panel, we were talking about negative consequences to the health of individuals on a global level, right? So health of the global community. And these projects are talking about health. The human is the European person. At a certain moment, proportionality, is there ever a point at which the negative ecological or negative consequences in general outweigh the positive benefits of these particular applications? You know, has your project thought about that? At a certain moment, the risks or the consequences are just too great, we probably shouldn't move forward with this technology.
Okay, I will be really quick because I think I'm talking too much, yeah? And yeah, these people will kick me out of the stage. Yeah, I think one of the issues, and you're right, is moving from research to the industry, let's say in a reasonable time frame. And as an example, the European research is pushing on something that maybe farmers are not very interested just because of economical reasons. And what we are trying is that all that we are doing, we are cooperating with some industries, but of course we will need to do some exploitation later on and find agreements on APRs and so many things to really be able to use it in the reality. And the reality is much more complex, needs the regulation, medical devices, etc., even with AI algorithms. So I believe in the project we have some things, some measures to really approach that and convert into something can be close to a product, of course. But as well, it's something that I think that European researchers we need to maybe put more attention or maybe include more in the sense that it's, sometimes you think when you start a project that you will be able to do that, but then you start discovering that the real life is not so easy when you go to the, to sell that to pharmacies, to hospitals, to others, or to even, industry. There's a lot of, things that are behind economical and, data models and many things that you need to tackle, let's say. But as well, it's a very, very, very nice wall to walk. Yeah, I think it's a second question.
There was a second question to be answered.
No, the second question I'm not going to say because I talk too much, but I passed it.
Just quickly to say that regarding the second question, I think it's an important one, and I must admit it's not been part of the scope of the project, but when I think about it, it's one thing that inspired me during these 2 days is that it's a very interesting one. So for example, we work on breast cancer, on predicting through AI the patient that will respond to certain treatments. At the moment, all the patients, they undergo...
Perfect sounds right.
Very nice.
So there is a subtype of breast cancer where 95% of the patients do not respond to chemotherapy. So imagine how much we would save if those women wouldn't have to go through, in addition to the physical and mental trauma of going through these really heavy procedures. So my answer is yes, there will be some benefits. I'm not able today to quantify it concretely, hopefully in a few years, but certainly something I was inspired about during these few days. Thank you for your question.
So, I mean, just to answer Federico, I mean, como está en tu casa, nobody is putting you out, but on the other side, I'm conscious of the fact that, and I think this was a good sign, that Tarzan could come here and kick us out. But also I'm conscious because when designing these workshops, say panel workshops with Greece, Signe, and the other colleagues, also the GConnect, we were wondering whether 2 hours is too little or too much. So because we are in a hybrid situation, so maybe next time we will use the InTouchAI.eu metaverse, and then maybe it will be easier to interact. So in that sense, I'm a bit, let's say, worried of time. So I see there are other questions. So we take a last one. And then we have a round of comments and discussions. So I see here.
I share a project that we're doing with a pediatric professor at the Karolinska Institutet in Stockholm, Sweden. As we are an AI ethical governance platform, we want to have a children's rights perspective on our screening offerings to ensure ethical AI. So what we did was that we broke the silos of the pediatric care giver, and then the child and the caregiver, and then the legal silo of the hospital, and then the procurement and the technical side of it. And because our question was, are children's and caregivers' rights, are they being accountable for when pediatric care is translated into AI health apps? So along the way, we find a method of exhausting the risks by using the actually different silos, the practitioner that would be translated into the business area. That's the doctor that is giving the care, that perspective, and then the legal perspective, and the technical perspective, and then the children's rights perspective. So these are 4 crucial integrated lenses when transforming physical care into the digital environment. I just wanted to comment that into because it is very difficult to grasp how medical journal legislation and patient care legislation is going to be translated in an assessment tool with additional AI regulation as well. So it's like a patchwork of different legislations. But we can do this by cutting the silos and having them be accountable for their understanding of where the AI solution is used, how is it used, what regulation is being applied to that. So there are solutions for this, I would say.
Thank you. So I don't know if someone wants to react to this, or otherwise maybe we move to the to another round, and so because we're getting to to the virtual paella that we will have at a certain point later after this. Actually, okay, I don't want to, otherwise Malavika will get too much used to start first. So let me start from Fosca. So, I mean, we've been discussing today a bit about, the European perspective. I mean, that's why we are here also to showcase a bit, what we believe, I mean, a bit proudly of the excellence we have developed in terms of research, especially in this area, I mean, where the EU is leading in many respects, also together with other countries. I know how can we engage in a cooperation at the international level. So, I mean, so what are the elements? You are, I mean, there are many professors here, but let's say, Professor, what are the main elements of the European AI project that we have seen in the area of health that you think are, let's say, the most valuable for really enabling a global approach?
Yeah. Can I say something before answering to your specific question? Because I think that I have to say something on Trustworthy AI. Trustworthy AI, which is has the fantastic. I'm coordinating a work package on Trustworthy AI and all the various dimensions. They have a lot of challenge, but this is in some sense we already know how to do a good development of an AI systems. So I'm teaching CRISP model since 20 years, when all the steps of a knowledge discovery process and putting in service a system which is based on a data-driven model, might be a clustering model, a machine learning model. So all those steps are already very well known since 30 years. So we have to do a business understanding to know very well which are the users, the different personas which have to be involved with the system. So we have to do data understanding. That means we have to do a lot of statistical observation on the data, and then we have to apply a variety of different models. We have to do the documents. Each of these steps has an enormous lines of documents to be produced. So who is the owner, where is the sources, where are the null values, so all those things are already there. So it's not that we have to forget now all this entire process. Of course, machine learning methods have challenged several things, put new challenges. For example, someone was saying, how can we know, we have done the assessment of a model and then we do the day after is not anymore. I mean, there is a function, it's a decay function. When you model a machine learning model, you also insert in the model, there is the study when the model with respect to the training set is still valid or not. There is this decay function, and there is a moment, even with clustering, you don't need to have a very exceptional technology, not deep learning. With clustering, there is a moment that you saw that your data are not anymore valid for that. So, and you have to do a retraining. So those things, so those are things that are already there. Of course, there are the new challenge, and having a regulation, it's very, very much important. Having also the guideline, the Altai guidelines, are fantastic. In some sense, they compare the developers to ask the appropriate questions themselves. So, I mean, given this problem, given this context, given these requirements, given these personas, Do you need a deep learning model? It's enough a decision tree. So there are all those things that you can take the decision question to be done in advance. So that's just to say that, so first of all, we have to do a very, I would say, done at art. Any AI system, a data-driven system has to be developed, designed at art. And at the design phase, of course, all those questions have to be asked and documented. And then, of course, so we have to separate what we already know to do and the new challenges that are there. We cannot forget which already it's there. Of course, we don't know how to do federated learning. That's the very complex. There are plenty of other things that can do. So, given said that, and also it's very important to have something that we don't know yet very well to compute the digital footprint, so the environmental footprint of the entire pipeline. There are plenty of technology that don't know this. Of course, even satellite technology, we don't know exactly what is the comparison between the cost of launching the satellite, which is environmentally enormous, with respect to how many usage it has. So it is very, very important. It is, of course, we have to learn how to measure the environmental footprint in the AI technology as in any other technology. But please do something. When you compute, when you show these needs, which is important because we have to learn ourselves to have a different perception that we are putting a new technology in society, so we have to observe all those dimensions, very, very much important. But we cannot say that the cost is only the cost of the training, because the cost of the training is enormous, but then the training, it's only one part of then there is the usage of the AI system, and the usage of so we have to be capable, and we don't know yet how to measure the training, the environmental impact, with respect to the usage and the advantages, of course. Otherwise, you only say, okay, why we launch the satellites in the sphere? It costs a lot. Don't do this. It's true that it costs a lot. It costs a lot in terms of environmental impact. So we have to be. Otherwise, there is the risk that we are not, how to say, enough impactful, in the sense that. In doing and convincing, particularly the data scientists, I know that those are the hardest to be convinced that those dimensions have to be considered. Otherwise, they will say, okay, but you don't the privacy, so you do not even read the privacy statement. You go down and then you just check, and then you go in the up at the next stage. This is not a good reason, of course, for saying that privacy is not important, but it's sure that we have to be very impactful in convincing the people. So I do not answer your question because I...
No. Well, I mean, there are many elements that you actually mentioned, and also actually made a bridge that is not the first time between let's say, sustainability in terms of environment and social sustainability that we are also discussing now with the healthcare system. So, but okay, but because this is so next time, in fact, we will probably need to take the broader sustainability concepts that, in fact, was also mentioned yesterday in the keynote by Amy. So let's move. I mean, building on this, because of course, at the global level, I mean, even in Europe, we know that. In some areas we have digital divides, but at the global level this is even more evident, and we know that digital divides are not static, so it's dynamic, no? So Signe was saying before, by the time you start assessing something, it's already obsolete, and this, especially with this technology, it's more and more the case. So maybe Ronnie, also based on all your experience and in research, not only in Europe but worldwide, so we see that some countries still lack the proper digital infrastructures, no? So these, of course, affect the access to also high-quality treatment that are enabled by artificial intelligence. So what could be the role of Europe in eliminating actually inequality in access to AI-supported treatment, because of course of the excellent, let's say, research that we have, and how this can be, let's say, enabling cooperation and supporting international, let's say, activities.
Right, thanks. I would like to flip the sides here because, you know, whenever this question comes up, then I'm expected to say, you know, we Europe, we need to help out those that can be left behind because we're so advanced and, you know, we are the good guys in the global stage, which is true, but I would like to flip the side and look, take a step back, and what is happening now, as I was trying to mention before, we are in a paradigm shift, right? Some call it from Web 2.0 to Web 3.0, some call it Industry 4.0, some other call it, you know, the journey towards singularity, whatever. From a power and resources point of view, I think this means that there's a reshuffling of the global value chain where similarly to what has happened before, you know, with the commercialization of the internet and later on with the Web 2.0 social media revolution, some areas of the world became, you know, low value added, you could say, for instance, sources of data, which would then be captured by other players in the value chain, which would then profit from them in order to develop their platforms and then resell those services to the ones that provided the raw material, right? The whole metaphor here is that data is the new oil. So again, I think this is a wake-up call for Europe, and I'm saying this in an optimistic way, but I'm nevertheless saying it. We need to make sure that we won't be at the tail end of the value chain ourselves, where we're going to be the source of data training for algorithms that are designed, managed, and exploited by someone else. And by someone else, I mean non-European country in the global arena. So in one way, I would like to be provocative and say, at the end of the next round of paradigm shift in the digital evolution, we might be at the wrong end of the digital divide where we are the ones that are left behind. Now, having said that, of course, we already know that the digital divide is there. It's a legacy phenomenon where there's, of course, lack of infrastructure in a lot of parts of the world that to some extent overlap with the gross distinction between developing and developed countries, which is, you know, a distinction that I like to challenge. I like to speak more of the majority world and the minority world, which we are part of, at least in terms of scale. So in that sense, I think a great initiative or a way to approach that would be to look into, of course, physical infrastructure, but also infrastructure in terms of fostering digital literacy. So in order to exploit that the data value gets captured by other parts of the value chain, we need to really foster a literacy where societies become aware of the value of data, they become aware of the value of fostering trust, and going back to the idea of trustworthiness, one risk here is that we do a desk work where we sit down among very bright experts and say, this is what trust is, and we need to instill trust in the algorithms that we design and in the policies that we do. But similarly to sustainability, as Amy and the panel before was saying, trust is a concept that changes across time and across space as well. So trust in Europe is different than trust in China, that is different in trust in North America. So we need to expand this dialogue where we have the vocabulary to speak about data, about trust, and we need a digitally literate population that allows this to happen on a global scale. Let's look at what happened with COVID. we realized that there's a deficit of trust because there was a deficit of literacy on how science works and on how science interacts with technology. You don't solve that just by building new physical infrastructure, but you solve that with education and with the spreading of a shared understanding of a vocabulary. Last point, I would like to say that we are not also naive about that. When we talk about artificial intelligence, there's the key elephant in the room, which is the data sovereignty question. Of course, we need more integration to create economies of scale, but we also need to preserve the different community values that are embedded in those data sets. So I would say we should start, instead of idealistically and maybe not effectively think about absolute global cooperation, we need to build a level playing field for what many call co-opetition, where we're able to have some shared standards, we're able to cooperate maybe with the federal model that was mentioned before, but still compete in terms of value chain and in terms of system of values that are embedded in this data. I think this could be a way to approach the next challenges that we're going to face, or that we're already facing, in terms of who is going to capture the most value in the global value chain of AI, and who is going to showcase their own societal values most effectively.
Well, thanks. And actually, well, Professor Medaglia is giving us the homework for the next module, because this is this will be the starting of another discussion. And clearly, as we said at the very beginning, this is just the beginning. And it is important that we link this debate to what we said before, that is the recommendations that we want to put forward in this report that we will prepare all together. So you will also have some homeworks, because the idea is to really not just have a debate, but actually try to put some some suggestions for our policy colleagues and also for research. And I'll be back on that. Also learning from the project, but then maybe Isabel can actually help us also in another difficult question, trying answering a difficult question that I'm sure will need more elaboration. But one of the actors that clearly is fundamental in this trust building relationship is also the private sector, And so especially there's a lot of debate on how we can support new startups that actually address AI for health. So, I mean, what is, in your opinion, the main challenges that we have to address in this specific area?
Yeah, talking about trust, I guess startups, an issue they have at the beginning is having the right connections to find the right people, and then making them trust that you have a solution they can work with, where you use the data, for especially when you work with hospitals. How do you make them trust you, that you don't use the data that you receive for other purposes for your company? So it's very important to be very transparent, to make them understand how your solution works, to show how the data is protected, which measures you have in place to secure the data, and just be very open and have an open conversation. But I think networking the right connections is very important for startups at that point. And also going back to the engagement again, it's having them involved very early on in the development stage of the solution that you have. Talk with the healthcare stakeholders, talk with the people that you actually offer the solution for, what they need, how to make them trust you, and manage expectations, understand what you can offer, what you cannot offer, what your limits are. And I think what also startups are struggling a lot with is that the European Union has a lot of regulations and a lot of guidelines and a lot of things that you actually have to do, but many startups start with 2 people having an idea, or just 1 person. They don't have legal teams, ethicists, other people. So it's this bureaucratic jungle with a lot of things, a lot of information in different places, in different spots, them not knowing, just having maybe being a developer and another person, and they need help with that. So Signe was mentioning the stamp of approval or something, or a certificate or something. Like, for example, many projects start with the same ethical issues and everything. So if you have already a solution done by European projects, why not give it the stamp and say, look, this is an approved solution, this is how you can protect the data, this is how you can store the data, this is how you can ensure that the data is secure and you can share it, or the data is anonymized like that. If you have a solution like that, why not share it with the startups that don't have the knowledge and the resources to actually, you know, and you help them saving time with spending hours on the internet to see, like, okay, how can I actually make my data secure?
Well, thanks. Actually, this is a great bridge to I didn't forget about Malavika, so now we get to you, because it's true that you know, we have in Europe, I mean, there's a lot of, let's say, effort to try to share practices, of course, that are responsible. You know, we have this principle of responsible research innovation, open science, and really there's a lot of assistance, not only from a funding perspective. So then, I mean, how we, and again, talking about trust and cross borders, so how, when we go out of Europe, so how we can, let's say, make sure that there is trust in these technologies and that collaboration, because, I mean, we all know there is a great potential from artificial intelligence. It's actually the first, let's say, area where healthcare, where artificial intelligence can really make the difference, and for humanity, I would say. So what is your view on that? On you know, how do we build the trust, you know, between you know, different part of the world, I would say.
Yeah. Something that's really interesting when you're looking at sort of very data-intensive operations is, in a lot of the world, we've talked about divides, you know, digital divides or data literacy and gaps. And I think Ricardo has a really great paper on, you know, data gaps and divides, which is really interesting. I would recommend it to anyone who wants to understand this. And I think in a lot of the world where you don't have data-rich environments, you find proxies, right? So somebody wants to finance people, you don't have a credit scoring index, you don't have a history of how you measure credit worthiness, you look for other proxies. Sometimes they're great, sometimes they can be super creepy, where they're using data given in a social context to make a decision about your credit worthiness in a financial context, right? So one example is in a lot of Africa, microfinance platforms would look at a host of data points gathered from your social profiles and other data that they would gather from telecoms operators. And one of them was how frequently you charged your phone, or it drained during the day. Because if you didn't charge your phone every night, you were probably a really irresponsible person who wouldn't be able to repay a debt, so we shouldn't lend to you. Which completely ignored the fact that maybe the nearest charging point was 50 miles away, and you're a woman with 6 children who need to go to school, and you're working in the fields. Maybe it's not an act of irresponsibility to not charge your phone, but a lack of resources and the environment that you're in, which you don't have a lot of control over. And I think the reason I bring this up is that when you have these kinds of environments, there is always this feeling that people are fundamentally untrustworthy, that people must be presumed to be wrong, people must be presumed to be fraudulent, to be on the take, until proven otherwise. And I think we focus so much on the trust of systems without really focusing on the trust relationship between people and governments, people and institutions. If I don't trust my government and they unleash a welfare program or a health program, I am not going to sign up. I'm not going to hand over my data, even if it would solve healthcare problems in my jurisdiction. I'm just not going to do it. So I think however amazing and robust a system is, if it's embedded in a situation where other elements of trust are suspect, I think that fundamentally alters your ability or your willingness to be an active participant in that space. And I think, you know, we've talked a lot about marginalized communities and vulnerable populations. They can be completely forgiven for not trusting anything or anyone when their whole experience, their whole lived experience and history is to not trust anything bigger than them. They've been let down time and again, they've been oppressed, they've had their data gathered, extracted, and there is no feedback loop, right? And I think that's a word I haven't really heard used today or yesterday, where there's a very extractive, predatory relationship where researchers parachute into a place they know very little about. They hoover up vast amounts of data under humanitarian or other kinds of umbrellas. They're assumed to be the good guys. They're assumed to be doing it with the best intentions of people, but they're humanitarian actors. They're not technologists. They're not using differential privacy or homomorphic encryption. They're the UN, right? They're sort of, I'm the good guy. I came here. I'm helping you. I'm improving your quality of life. And there is a tendency in sort of crises to gather as much data as you possibly can because you think I'm never going to be able to go back into this conflict area, into this high-risk situation. So I'll just take everything. Some techie is going to redact or wipe out things we don't need. I don't need to worry about data minimization because I'm just the healthcare worker. Or there's some annoying lawyer who's going to say I'm not allowed to use X or Y, and they will clean the data set for me. Surprise, you know, public service announcement, we're not, as a lawyer, we're not trained in data gathering and practices either. So everybody assumes and kicks the can down the road thinking somebody else will worry about the security and privacy implications. And so I think so many of these elements form part of a context of trust, and if you don't see them as socio-technical systems, which you also mentioned, where the AI and the black box and the input and the output and the algorithm, this is a very, you know, it's a very bounded system. But if you don't actually extend the boundaries of your field of inquiry to look at all the other variables, the human, the political, the geopolitical, the power relationships, the gender inequality, the income, class, caste, if you don't look at all of these things and model them as part of your system, as opposed to something extraneous to your system, if you don't see trust and fairness as part of what you're modeling for, and I think procedural fairness is also something really important. Like we always see that when it comes to litigating other things, there is a certain effective and legalistic belief when it comes to trust that you have your day in court. You could fail. You could not be awarded a $5 million settlement, but you had your moment to say your truth and to have it heard by other people. That's a requirement of procedural fairness that might not affect the outcome, but affects trust in the legal system, in the rule of law. And if you took that away, saying it doesn't actually affect the material outcomes of what the judge or the jury is going to decide, you might think it's irrelevant, or it's like little fluff on the side, it's a little pomp and ceremony, but it doesn't mean anything. But that actually fundamentally affects trust in the entire system, without which people don't believe in law. So I think when we think of gaps, when we think of trust, when we think of like different international and cultural approaches to trustworthiness, you have to model for all of these things. And to be provocative, and I'm not picking on you, even though I'm sure you have the best of intentions, if you're a tiny startup and you think this is bureaucratic, please find some other business to be in. Because if you can't handle the bureaucracy of federal aviation guidelines, don't be Boeing. Right? If you can't handle healthcare requirements that deal with really human lived experiences and outcomes, maybe you should be in fashion and not healthcare, right? So I think bureaucracy as an impediment, saying, oh my God, please simplify everything because it's so hard for small companies, then let the big people deal with it. And this is not to say that some rules are not bureaucratic by design and terrible and should be simplified, but just saying that there is an element of scale, and to say that it hampers innovation is kind of disingenuous, because there are real people's real stakes at heart, whether they live or die, whether the insurance premiums make it impossible for them to get health care beyond 2 days in a hospital because they don't have the money to pay. that's a big boy's game or a big woman's game.
Thank you. I mean, you mentioned feedback loop and FOSCA complexity, so maybe, yeah.
You were very provocative and very interesting. So you said two things about the fact that the socio-technical system. So this is an important issue because it changes very much the perspective. For example, accuracy 99%, maybe not useful if at the end the decision of the machine plus the humans is not better. So that means that we have to change completely. That's particularly for those which are designing AI system and they want to put in service AI systems, any system, but those which are human-machine, such socio-technical ecosystem. We need to change the paradigm with respect to validation. That means we have to do as physicians do. We have to adopt trials that where also the humans are involved in such validation process. So I think this is something which really changed very much the kind of measures that we will have to put in place for the validation. And as far as you said for the companies, I think that you are giving this perspective from not European countries' citizens, because when bureaucracy, it's really a lot in our countries. So I think that helping the startup to facilitate this part, well, particularly in at least as far as the privacy, the data privacy issues. So you give them an extra tool. So in some sense, I think that helping them it's an important step for putting them in a different, at least for the European market.
Well, thanks a lot. And
maybe, yes, just to clarify, I didn't say to reduce the bureaucracy, I just said to help them, to give them the tools and to, yeah, because like it's, yeah.
Okay, so.
I'm not answering.
Okay. Yeah. Okay, so now this is really, I mean, this is really the spirit of the workshop that I'm sure we will have the opportunity to have again later on. But as we are really getting close to the closing, and also I would like then to call on stage my colleagues. I mean, and my loop is easier because, you know, as I said at the very beginning, I live in Spain, so I came from Madrid, and now I'm going back to Barcelona. So let's make this very quick loop with Federico and Karim on you know, it will be, I mean, this will be another conference in itself. But, I mean, if you have the opportunity, you know, the famous elevator pitch, you know, to tell what are the main challenges that after the discussion we had today, but also the big opportunities that you see in using AI technologies to support healthcare, what you would prioritize, no? Where should, you know, the European Commission put the money for research, and what we should invest on for making sure that these ecosystems of excellent trust really work and can be beneficial for all?
I would say what the European Commission and Europe is doing at the moment is the right thing. That is, in particular, focus on facilitating access to data. There are other things, I'm not saying this, but I think at the moment the strategy is the right one, not only for developing, but also for testing. So, for example, there's at the moment a program called Digital Europe, and one of the programs is to build a TEF, what they call a TEF, a testing and experimentation facility for AI that companies in Europe will have access to against a fee. This would be a network of hospitals with computational capabilities to then validate the AI solution that will be built by these companies while respecting these principles of trustworthiness. This is, for example, something that will be revolutionary when it's built and when it's scaled across Europe, just to give an example.
Thanks, merci.
Okay, well, there are many things, okay? I think some of them were mentioned. So I think that really connecting the different hospital and clinics, places where we can find this data, okay, especially for some diseases that are not so common, and then try to find a way with, of course, all the regulation, ethical part in place. So let's say that researchers can do AI and test things. So I think it's very important as well for small researchers that to go and go big. Second, maybe it's the provision of big infrastructures where you can compute and compete with other people, other even companies that they have a lot of computational power that are having. And the third one, I think that we already mentioned, is how transition from the researchers doing something that is valuable to bring this to something that will arrive to a hospital, will work, will comply with regulations, and will be finally adopted. So finally, the European patients can benefit from the AI. We are doing a lot of algorithms that we are doing, and that finally are in place and working in, with real world data. So I think that the three areas that I think that I would, if I had that money, I can suggest something. Maybe not, but okay. Nobody's going to pay attention to my advices, but since I'm in a kind of panel and this is recorded, so maybe someone is doing this.
Thanks a lot. And who says that in Spain people is late? Yeah, we're just at 7 o'clock, and I think we are getting to the close of this workshop. So thanks a lot. I will actually make a round of applause to our panelists. Yes, unless Signe has anything to add on this, we could also maybe call upon Gri, of course, and also Juha Heikkilä, so we can make maybe just say a few words to close. And so thanks again for the discussion. You say, yes. You can use one of these, so.
Yes, well, thank you everyone. This has been a lovely day, a little bit of, as I said earlier, a marathon on human-centric AI, European human-centric AI, with some fantastic input from both from Europe, but actually also with a global perspective, and that's what we really wanted to do with this event.
Well, I would actually invite Juha to close this and maybe. Yes.
It's on. Okay. Good afternoon, ladies and gentlemen. My name is Juha Heikkilä. I'm advisor for artificial intelligence. For those who did not follow the panel yesterday, which I chaired, so let me just say very briefly a couple of words. With these sessions here at the Expo, we wanted to do a couple of things. First of all, we wanted to bring this European approach to AI, trust and excellence and trust, to a broader audience, and we saw the Expo as an opportunity to do that. And I think this we wanted to also link, and I think that was successful, but we wanted to link this also to an international perspective, and therefore we brought international speakers from other parts of the world who could comment on this, bring their perspective to bear, to give their views on how we do things here in the EU, and how they see it, how they perceive it, and how that could perhaps also be interesting from their perspective. And as far as I'm concerned, this has been very successful. So I think that the discussions we had yesterday, the speeches, the panels yesterday and today, I think they've been very, very good in bringing out this aspect and also commenting on it. So I'm very pleased myself with this. So showcasing European excellence has been very clearly on display today. Since I was in my previous role also in charge of research projects, or in the role before my previous role, in my previous role I was then also supervising the management of research projects, funding them, etc. I was particularly pleased to see those projects today to get the kind of visibility that unfortunately they don't always get. Visibility they deserve, to also show what is being done in the field in practical terms to advance these systems to make our lives better. And of course, this cannot be done without the link to policy. And this has been, I think, very clear throughout these sessions yesterday and today. So, showcasing excellence and the links with policy, this has been very successful. And I would like to thank all the speakers who made the effort, who gave their contribution yesterday and today. This has been very valuable. It is highly appreciated by the European Commission, and we think that this has been very successful in every respect. So a very big thank you to all the speakers who took the trouble of making their contribution, also traveling here, attending, those who contributed online because they could not make it for various reasons. And I would also like to thank InTouchAI for all the efforts they made. Also, Commission colleagues behind who worked very hard on this, in particular Jola Dervishai. And I would like to also thank the delegation here who has supported us and all those who made this possible. So a very big thank you indeed. And I would like to close by saying, as we say in Finnish, let's smile when we meet again. Thank you.
Now, hey, yeah, for real.
Paella.
Yeah, no? I mean, Rania will say something. Yeah, yes, let's make a group photo. So I don't know if we are still on live on streaming. Unfortunately, it's no streaming with a photo, but maybe we can, we can have a group photo for all who remained here today. That is great. Yeah.